Hi everyone, my name is Lelaine Robles, and today I'll be presenting Addison's disease presentation. This presentation is for the course Biology 164, Introduction to Human Anatomy and Physiology, with Dr. Cummings. The purpose of this research is to educate experts and the general public about the disease. We'll also discuss what Addison's disease is, and we'll focus on different areas Addison's disease affects. Let's talk about the background of Addison's disease. Addison's disease is actually named after Thomas Addison, which is the person who first identified Addison's disease in his medical literature in 1855. Addison's disease is an uncommon disorder that is also known as adrenal insufficiency. It is when the adrenal glands don't produce enough amount of hormone cortisol. The deficiency of cortisol is usually characterized by low blood pressure. Alrighty, so let's talk about what Addison's disease looks like in the body. On the top of the diagram, you'll see the abbreviation of POMC. POMC actually stands for pro-opiomelanocortin. That contains melanocyte-stimulating hormone, which is MSH, which is also released with the production of ACTH. Because there is increase in MSH, the subsequent deposition of MSH in the skin is responsible for the well-recognized hyperpigmentation of Addison's patients. That is why we see these patients with a lot of those hyperpigmentation that looks like dots in the skin. And then on the right side, you will see that there is Na plus low. That means there is a low amount of sodium in the body, which explains why Addison's disease patients crave a lot of salty foods. Down here at the bottom of the diagram, you'll see that this person is always tired. They may experience a lot of weakness, fatigue, stress, and then on top of that, they can also experience nausea, vomiting, and that's because of the low cortisol in the body. So we'll talk more about this stimulation test once we get to the treatment part and the diagnosis part of the presentation. But overall, this is what Addison's disease looks like in the body. So let's talk about the causes of Addison's disease. So what causes Addison's disease? Well, one of the causes may be an injury to the adrenal gland. It can also result from infections such as tuberculosis and HIV or AIDS-related diseases. Addison's disease may come from cancerous cells from another part of the body that has invaded the adrenal gland. It can also be from bleeding into the adrenal gland or abnormal buildup of certain protein in the organ. Now that we discussed the causes of Addison's disease, let's talk about who is at risk. So Addison's disease is actually very uncommon. It only affects 1 in 100,000 people. Both men and women are equally affected, although some studies suggest that women are more susceptible to the disease. 30 to 50 years old are actually the people who get this diseases a lot. However, that still doesn't mean that children cannot get this disease. Addison's disease can still occur in children. So now let's talk about the symptoms of Addison's disease. As we discussed in the first couple slides, there are going to be patches of dark skin that are visible. As you can see on the right diagram, from Stat Pearl's publishing illustration, they are showing the darkening of the skin. We also talked about the craving of salty foods because of the low level of sodium. And then the person may also feel dehydrated. And then we talked about muscle weakness and loss of appetite. On the diagram, again, you will see that they explained Addison disease patients can experience muscle pain and joint pain, along with nausea, vomiting, and diarrhea. The diagnosis for this disease includes different types of exams. The doctors may perform a physical exam after reviewing the history of the symptoms. They may also do a blood test to check for the levels of sodium, potassium, cortisol, and ACTH. ACTH simulation test is also helpful in diagnosing this disease. This test analyzes the adrenal gland's response after a person is given a shot of artificial ACTH. If the adrenal glands produce low level of cortisol after the shot, they may not be functioning properly. The doctor may also do an X-ray to look for calcium deposits in the adrenal gland. And then lastly, they can do a CT scan because it can show if the immune system has damaged the adrenal gland or if the adrenal gland is already infected. The risk factors for the autoimmune type of Addison's disease include other autoimmune diseases, such as type 1 diabetes, chronic thyroiditis, testicle dysfunction, vitiligo, and Graves' disease. The treatment for Addison's disease is actually a lot of medication. The first one is corticosteroid medicine. This medicine is used to provide relief for the inflamed areas of the body. The second one is hydrocortisone medicine. This can be used as a hormone replacement for the people who don't have enough natural stress hormone, such as cortisol. The third one is DHEA medicine. It is a hormone produced by the body's adrenal glands, and the body uses DHEA to make androgens and estrogens. Lastly, there is the prednisolone medicine, which can be used alone or with other medication to treat symptoms of low corticosteroid levels. Addison's disease cannot be prevented, but there are ways you can take to avoid Addisonian crisis. This includes talking to your doctor if you're always feeling weak. If you're also feeling fatigue and had a lot of weight loss lately, you can ask your doctor if they can check for adrenal shortage. If you already have an Addison's disease, you can ask your doctor for recommendation on learning on how to increase the dose of your corticosteroid medication. So there actually has not been any significant innovation for more than 60 years to cure Addison's disease, meaning there is still no cure for this disease. But the most recent finding is about a conventional steroid replacement, which consists of 2 to 3 times daily oral hydrocortisone and once daily fludrocortisone. In conclusion, we discuss the causes of Addison's disease, who is affected, the symptoms, diagnosis, risk factors, treatment, and preventions. Here are my references. And if you have any questions, comments, or concerns, you can send me a quick chat on Leo, or you can email me at lelaine.robles11@student.umgc.edu. Thank you, and have a great day.